Right, welcome back to Morning Live. Dr. Madhura Joshi is with me here, and she's from the MediHealth Group of Hospitals, and we want to talk about child obesity and all the complications with so many things, also even as far as child diabetes. No one knew actually that children can actually get diabetes. Wow, interesting. Doc, good morning.
Very good morning, Jay.
All right. Now, when you want to talk about child obesity, sometimes it's not so common because we always insist on feeding our children, our kids for that matter, or our babies for that matter. And not only feeding, overfeeding our babies. But of course, we must talk about overfeeding. But now, there's some causative factors that are actually now involved in this. What are some of them?
Yes, childhood obesity right now is gaining epidemic proportions. You know,
Okay.
it's coming in a large number, and we get a lot of OPD referrals for childhood obesity.
Okay.
And almost 90 to 95% of the patients that we see in our OPD, they are becoming obese because of a lifestyle problem.
Okay.
And the remaining 5 to 10%, which is a lesser chunk, is
Okay.
actually because of endocrine problems, like an excess of steroid hormone such as Cushing's disease, or a lack of thyroid hormone, hypothyroidism, and certain other syndromic causes. So that is like a minority, but the majority of the chunk is because of lifestyle related issues.
Okay.
So when you talk about the causes, of course there is a genetic component. We have most often seen and observed that when parents are obese, the children are obese.
Oh.
So that is one important
genetic
factor.
connection also.
There is some genetic connection to
Okay,
obesity.
okay.
But largely what we have seen, the rise that has happened over the last 10 years, which is almost 4 to 5 fold
Okay.
that was, 10 years ago, that is largely because of the faulty lifestyle.
Okay.
So that will involve, eating a lot of processed food, a lot of junk food, and lack of physical activity because of multiple reasons.
Okay.
And essentially that, a faulty lifestyle that is resulting into childhood obesity.
Okay. Now, when you talk about processed foods, I understand sometimes even the parental schedules so tight these days that indeed no parent will just have time. Yes, I understand there's so many of us actually who've maybe employed house helps or house managers for that matter. But looking at the criteria of nutritional division, whereby a breakfast, this is what he or she will have, lunch, because it's 3 meals, or maybe sometimes milk. It's a cycle that not so many people understand. Maybe do we, after maybe of course giving birth and everything, that process of discharge, are young parents taken through the feeding cycle so that they understand indeed some catastrophic results here?
Generally, when the parents follow up with their children after birth for immunizations, as well as for later on for any minor problems, minor ailments, we do emphasize about healthy eating practices and what a child should eat, what are the good foods or the healthy foods that a child can eat. But I feel we need to emphasize it a little more in this era today. And parents also should be a bit more conscious about what the child is eating. See, it's like you have to choose for the healthy option. Multiple options are available, and with the advertisement era, the children also demand for options which are, tasty, more tasty and more attractive, lucrative. But consciously, the child also must be made aware of the healthier option as opposed to the fattening kind of food or the calorie dense food. So of course it's a gradual process. The parents should first understand this, and then they should pass it on to the children. And with the tight schedules, it is difficult to always be aware of what the child is eating. But still a certain way can be made out, and a timetable can be initially set. And generally after the infantile period, children start demanding food. They start demanding food when they are hungry. So force feeding, I feel, should not be practiced. When the child is demanding, he should have a certain routine, but it should not be like, it is time now, you sit and eat. There should be that, hunger cues should be understood, and the child should be allowed to feed on demand as he grows up.
I understand understand you've been to India for so many years, and you know, in the African society, when a child is fat, maybe kind of just chubby for that matter, we say he's healthy, or maybe she's healthy. And in Kenya we like to say kijana fupi round. You would understand that it only means that maybe short and kind of round. Now, you know, it's an African society which kind of depicts this, oh, he's so healthy, she's so healthy. The fact that they're fleshy, which kind of beats the odds on obesity or healthiness. Now, what are the signs that you can tell this child is obese?
Just by looking, sometimes yes, when the child is too fat, you can recognize that okay, he is heading towards
Way
obesity.
overboard, actually.
Yeah, but then what is actually advised is at each visit when the children come to the clinic, we should plot their weight and height on a growth chart, because that will help us recognize the children who are at risk of obesity. So if a particular child is, you know, climbing in the weight percentiles on a growth chart, when we see it, we can immediately make out, okay, he is heading towards becoming obese. And so such children can be you know, counseled at an earlier age, and action can be taken before obesity really sets in. You know, and chubby children, of course, they look cute, but obesity is associated with comorbidities, a lot many of them. Right during childhood as well as during adulthood. And studies have shown us that obese children grow up to be, they have more likelihood of becoming obese adults. So if checked now, we can avoid obesity in adulthood and the related comorbidities in adulthood.
Now, how can the problem be managed? Because as much as we can tell about the parental schedule on how they need to feed, but look at the genetics angle and just the carelessness from the parent. Now, how can this be managed?
Okay, so there is, like I said, there is an element of genetics that is involved, but environmental factors also play a major role as far as obesity is concerned. So adopting a healthy lifestyle will at least partly eliminate the environmental factors that we are talking about. So awareness, I think, is very important in this regard. Parents should first become aware that obesity is a problem and it can cause future problems. So consciously adopting to a healthy lifestyle right from a younger age is, I think, a very important factor to avoid many certain things that can happen in future.
It's true. Now, health implications, because as much as you're chubby, you look good, people like to play with you, you know what I mean? But you see, you might look good, but you have some serious health effects on you. Which are some of these effects?
Yes, obesity in childhood particularly, as I said, they are more likely to become obese as adults. And even during childhood, it will affect almost every organ system in the body. This we are not very much aware of. So when we have seen so many patients, we realize that, oh, he's having this problem as well, that problem as well. To give a broad overview, these children have a lot of headaches. They can have problems during the sleep. They are not able to breathe properly. We call it sleep apnea. So in there, they have a disturbed sleep, and in the morning they can have daytime somnolence. They have a lot more of cardiovascular issues. Earlier we thought that hypertension and diabetes is something that happens only to the adults, but it is not so. We are seeing almost 5 to 10% of children who are getting diabetes in the adolescence age group because of obesity. So that is one important thing. So cardiovascular system effects of obesity, like hypertension, dyslipidemia. They even have lipid disorders at such a young age. And then they can have problems with the endocrine system as well. Like the puberty can be early in these children, but in some of the boys we have also seen that it is delayed. And a whole lot of issues like menstrual abnormalities in adolescence due to polycystic ovarian syndrome is also related to the obesity. And there are other problems with the bones. They can have fractures, they can have deformities like Blount's disease. So the last week I saw a child who was 13 years old and his weight was over 90 kilos. Of course, he had a good height, but still his BMI was very high, which was indicative of adiposity or fat, high fat in content.
Okay.
And he had come with the primary complaint of not being able to play football because of a deformity of his left lower limb.
Yeah.
So this was something due to obesity that that had aggravated, you know,
Okay.
and so the bony problems. And then there are psychological issues with these children. So like many of them may face depression. They have a low self-esteem, exactly. So multiple things happening in the body just because of obesity, which is preventable.
Okay. Now, when you talk about trickling to adulthood, yes, we've seen fat people around us. We've seen these people who kind of they feel proud of their bodies, and they're not doing anything about it. They're eating the way they're eating. Exercising is not even part of their lifestyle. And as much as these are kids, look at the elderly. Can they work something out? Because it's very important. People can't run, people can't even talk. Respiratory problems, like people can't even breathe well. Like just before we take a break, the solution now to even the adults, because now we're talking about the kids, yes, the issues, obesity and everything, but it also trickles down to the adults. Now, what should they do? Because it's a problem. Everyone is going to the gym to cut weight, to keep fit, to tone. But look, the people who sit down, eat what they eat, just live the normal lifestyles, and they're not scared about this.
Yes. See, I think I'll talk about children first, and then I'll go on to adults. See, in children, what we have noticed is if we keep telling them, you know, you have to cut down on your weight, you know, they don't relate to it. They don't relate to decrease in a certain kilos. But when you tell them, like I told that boy, you will be able to play football fantastically if you go down on your weight, because the deformity may not progress if you decrease your weight. So when you're counseling them, you need to relate to issues which they understand. Now, suppose a child is studious, you need to tell him or her, if you cut down on your weight, it will help you study better. You will be alert, and you know, you will be able to concentrate on your studies better. So while counseling, you have to tell them about the side effects of obesity, of course, so that they understand that. But I think relating to something that they understand better is important, so that they'll start thinking towards having that kind of a lifestyle. Okay. And as far as adults are concerned, I think you can only tell them to do something, but getting on to do it is a bit difficult. But when you actually see the results, you know, when you actually see the weight loss, 2 to 5% coming down, that is when I think they are more motivated to stick to the lifestyle pattern that we suggest as doctors.
Okay. Now, from the medical angle,
one more thing I wanted to talk about. It's not that dieting should be like, you know, starving or, you know, not eating. It is about healthy food choice, like eating an apple instead of a packet of biscuits. It's very simple to get these processed foods over the market, just shell money and buy it. And the healthy food options may even be a bit costlier as compared to this junk. But I think, like, suppose you feel hungry at a certain point of time, and you have two choices. You have a packet of biscuits, or you have chips, and you have a banana or an apple. I think you should start going for this option rather than this. That will go a long way in changing your behavior and setting in that pattern of a good lifestyle.
It's true that. Wow, very interesting. Because now I understand, you know, with the lifestyle the elderly kind of live, you know, you're so busy, and you don't have the time to maybe grab something kind of, we always say grab something legit that is organic, maybe fruity, vitamin A, rich in vitamin A or something, but we always go for that junk, the quick fix. We'll go somewhere, get the chips, get something, quick fix, go back to work. But you know, you're going back to work to sit down again, and you're of course using your brain, no muscle, something else, and it's kind of very catastrophic. Now looking back to the children, what can the parents be instilled with? Because as much as we might say African society, we love our kids kind of fat, because also those people who are looking at your kid as a very thin kid, and they'll talk something about the kid, not only something ill, they talk ill about the kid. Now it's always the joy of a parent to see the kid fat. It's just very crazy, actually.
So at this point, I think doctors play a very important role. So when the parents are bringing their child for a visit, showing them the growth chart, showing them where the child is in terms of his weight and in terms of his height on the population growth charts. And then even if he looks thin, telling them that, okay, he is in between the 50th and 20th percentile or 25th percentile,
Sure.
meaning he is healthy.
Okay.
If he is trickling the lines below on the growth chart, then it is a cause of concern. So when you show the parents that chart and how the child is performing in terms of growth on the growth chart, it is an objective evidence for them, and they understand it better.
Okay.
And for the chubby children, when you show them the BMI charts, they actually realize where the child is in terms of BMI on the chart. So I think it's very important for clinicians over here to counsel the parents about thinness or fatness and giving them objective markers of obesity vis-a-vis failure to thrive.
What is the recommended BMI for a child?
The recommended BMI for children, I mean, we call the child as obese when the BMI is about above 25. Okay. And now there is some of like Indians, Africans. If you see the cutoff for the worlds, the cutoffs are 23 for overweight and 27 for obesity. But for our population, like Indians, Africans, we are a bit more prone to comorbidities, cardiovascular comorbidities at a lower BMI. So the cutoffs have been lowered down for us, and we use the cutoff of 23 and 25 for overweight and obesity.
Okay, interesting. Okay, we take a short break. When you come back now, Doc will now be talking to us about diabetes in children again, because as much as we're used to seeing the elderly now being affected regularly, children can also be affected. All that coming to you after a short break. Right, welcome back to Morning Live. Interesting conversation in the first part of this interview, and it was all about obesity in children. Right now, another crazy, I didn't have any idea, as much as the medic terms are sophisticated, diabetes in children. Who knew children can also be affected? Doc. Now, when children are affected by diabetes, that means I'm very sure it will be a very like a very long medical like complications, because now as a child, diabetes, how does it come actually?
Yeah, so if you see diabetes, it's a diabetes mellitus. We now know that there are various types of diabetes mellitus. So a variety that occurs more commonly in children is called type 1 diabetes.
Type 1 diabetes,
To a certain extent, the type 2 diabetes, which was earlier called an adult disease due to obesity and lifestyle, is creeping into the childhood age group as well. So that is the one which is lifestyle related type 2 diabetes, primarily occurring in the adult population. Then there is diabetes which can occur during pregnancy. We call it gestational diabetes. And there are other rarer causes of diabetes which could be genetic, monogenic, or related to some syndromic association. So the majority or the commonest type of diabetes which occurs in childhood is type 1 diabetes, and it is a completely different disease as compared to the type 2 one, which is obesity related or lifestyle related. So what is happening here in type 1 diabetes is that the pancreas, which is the organ that produces insulin, is kind of the cells which produce insulin, the beta cells of the pancreas, are getting destroyed due to a phenomenon called autoimmunity. So why this autoimmunity occurs and why a particular child is getting type 1 diabetes is still not clear. There is some amount of genetic predisposition, but again some environmental triggers, certain viruses may be involved in the actual causation of the or actual triggering of the autoimmunity leading to type 1 diabetes. But if you ask me one cause, we really don't know yet. But what we have observed is this is the common type affecting children age.
You know, when you talk about diabetes, sometimes what comes in is excess sugar. Those are the main factors now. But of course, you mentioned the cause is still not yet known. But look at the numbers that when you mention autoimmunity, look at the numbers of the children affected. How is it? 2013 International Diabetes Federation has mentioned that as many as 39,000 children
are affected with type 1 diabetes in sub-Saharan Africa.
Yeah.
The numbers are in millions over the world, but I'm just talking about sub-Saharan Africa.
Okay.
And I understand that in Kenya, whatever I read, there are over 1,500 children who are currently affected with type 1 diabetes
Okay,
and
okay.
receiving treatment for it.
Okay.
So here what is happening is insulin is not being produced. So the treatment comprises of giving insulin from outside.
Okay.
So the children are actually advised to take injection with insulin, a hormone that is important for regulating the glucose in the body. So insulin will help the glucose to be better utilized in
Yeah.
the peripheral tissues.
Okay.
So if insulin is not present, there will be abundant glucose in the blood, but the cells will not be able to utilize
Okay.
it.
Okay.
So when you give insulin from outside, all these processes will align and the blood sugar will go down and the child will be better.
Okay.
So, but then yes, they have to take insulin at each time they consume a meal, because they have to balance the amount of calories or carbohydrate that each meal is supplying, and the resultant rise in sugar is to be controlled or balanced with an injectable dose of insulin.
Okay. Now, that's the only treatment?
Unfortunately, yes. Currently,
Wow.
that's the only treatment.
Okay.
There has been a lot of development in terms of how the insulin is being delivered.
Okay.
Nowadays, we have insulin pumps, etc.
Yes.
But essentially, it is giving insulin or injecting insulin.
Okay.
So these development of the newer technologies have helped us to go down on the number of pricks the child is having every day by putting on a pump, and then the child can be on the insulin pump, and the needle needs to be changed just a couple of times in a week. But for multiple patients, we still use the multiple dose insulin regimens in a day.
It can be very confusing for a parent, because now on the early days, he or she might not know what's happening.
Yes.
And sometimes you go to tests, you avoid this major test, that is diabetes mellitus. But looking at the cost of all this, because now the child might be having a problem, maybe there's so much pain, and you go do the normal generic test in the hospital, you're charged so much. But now looking at the finesse of a doctor who can realize, let's do a diabetes type 1 test and find out what's happening. Now, the audacity of a professional to come up with such decisions is what is lacking in many of our hospitals around, even Kenya. Now, what can you advise a parent who is witnessing all these things, maybe the signs, to go and, of course, directly test for type 1?
Yeah, so actually very simple tests are used for diagnosing type 1, but then we have to catch the symptoms early. So generally in children, the symptoms are of drinking a lot of water. We call it polydipsia. The child is constantly demanding for water. Even in the night time, he may get up and ask for water. The second common symptom is excessive amount of urination. So he will go to pass urine multiple times a day, and the quantity will also be substantial. And the third symptom is he'll constantly be hungry. So all these three symptoms of polyphagia, polydipsia, polyuria are occurring because there is abundant sugar in the blood, but the body is unable to use it, and the kidneys have to throw the excess sugar out in the urine. So if vigilant parents can, some of them do come to us early before the child actually lands up in a complication called as diabetic ketoacidosis. Some conscious parents may recognize or witness these symptoms in front of them and go to a doctor to get a simple blood sugar tested or a urine sugar tested. Even a random blood sugar can, in these children who already have these symptoms, tell us whether it is type 1 diabetes or not. Now, many parents ask us, when we tell them that, oh, this is type 1 diabetes, for them to understand or to, kind of sink that in, it takes time. So many of them ask, how can you prove it? They are in that phase of denial when we first tell them that, okay, this is diabetes, if they are presenting early. So at that time, we do tell them that there are certain tests available where you can now check the antibodies in the body, which are being formed against the beta cell of pancreas. So those tests are available even in Kenya. Those are expensive tests, and we do it if the of course we try to do it for children, but in case it becomes difficult for us to counsel the parents, this is one way to tell them that this antibody titer has come positive. Almost 60 to 70% of the times the antibody results shows positive in a type 1 diabetes. And when you talked about, yes, when we come to know this, we do train parents for almost a week to 10 days, maybe in hospital not so long, 4 or 5 days, till they actually learn how to give the injections. They learn how much dose to give, according. This we do as a teamwork. We work with the dietitian and the child and the parents. We ask them what is the usual diet that they eat, how much the child eats at a particular time. Accordingly, we set the insulin dosages. And when we discharge them, we kind of teach them when to do the sugars, how to monitor the sugar and maintain a sugar diary, and how to deliver the dose of insulin. So that is gradually, see, the parents are the ones who are going to be the primary caretakers because they are going to be with the child all the time. So we kind of empower them with some knowledge that they will be able to take care of the child at home well. Some complications like hypoglycemia, etc., we teach them. So we call this diabetes education, and it happens right when the child is admitted. Now, majority of our children are admitted with a complication which is called as diabetic ketoacidosis. So the sugars have gone so high and the ketone have risen, and then the child ends up in diabetic ketoacidosis. It may even progress to coma, and the mortality rate in such children is quite high. So in order to, it cannot be prevented. If you notice the symptoms and a conscious parent comes, then you can catch these symptoms early. But still, most of the times the children come in DKA, and then they have to go through that course of ICU admissions and then insulin drips, and it is very expensive. But I feel it is not preventable. But yes, if the parent realizes that the child is having these symptoms of polyuria, polydipsia, or if the clinician realizes, then we have a scope of catching the disease early.
Now, the administration of insulin, how long does it happen actually?
How long does what happen?
Administration of insulin, that is.
This is a chronic disorder, and the child is having insulin deficiency and needs insulin lifelong.
Lifelong?
Yes.
Wow. That's quite something, because now for a parent who just having the thought of giving the child insulin for the rest of his or her life is kind of very detrimental also.
I understand. It is very difficult for us as doctors to tell them this. But then we do tell them that there are we then we have kind of support group meetings where we call our children who are already dealing with diabetes for a couple of years and doing well in their lives. We have a meeting for all the patients together, and then the ones who are newly diagnosed, they actually discuss their problems. And when we tell them that, and we have seen this, if they are able to manage their calorie intake with a proper dose of insulin, they do well in terms of glycemic control, and then they can live like other children, they can lead a normal life. So we give them examples, and with a multidisciplinary team, we are constantly psychologically, counseling them so that they can, whatever is the child's best potential is tapped, along with taking care of the disease, hand in hand.
Now, the cost, once you've realized now there's a problem, type 1 is now curving in, the cost of just trying to make sure this is managed, what's the cost?
It is different depending upon which treatment line you choose. So if you are on the multiple daily injection dose, then what you need is the insulins and the injections and the testing material, that is a glucometer and strips. So it is costly. Now I'm getting to know the costs in here in Kenya. In India it was different, and in Kenya it is different. So but then yes, I won't say that it is entirely, it is very less like a tablet or something. There is a cost involved in that. But and of course the newer technologies like the pumps, they are even costlier. The amount goes in lakhs and millions. But for those who cannot afford these injections, insulins, the glucometer, the strips and all, there are multiple organizations who are working to help the children with type 1 diabetes. So we could, a particular person feels that the cost is quite high, then he can approach, and we even give them information regarding that, and then the things can be worked out from there.
Wow, interesting. Now, just before I forget, noticing the thyroid disorders in a child.
If I may interrupt.
Yeah, sure.
There is one more thing that is involved. As I told you, the disorder is chronic.
Yeah.
So when we start treating them, eventually we also emphasize the importance of follow-up. It is very important in these children to follow up timely as advised, because when they get diabetes early and the glycemic control or the glucose control is not good, then they are exposed to a whole lot of complications later on related to the kidney disease, the heart disease, the retinal disease and all those things. So here the follow-up is very essential for these children.
Okay, all right.
And
okay. Now the thyroid, I think we forgot about it. The thyroid disorders, just quickly before we wind up.
Yeah, that is just second in line, which is common as you know, as compared to type 1 diabetes. It is the second most common endocrine problem in children, and they do exist. So we all know that we have a butterfly-shaped gland, which is called the thyroid gland in the neck, and it is very important. The thyroid hormones which the gland secretes have effects all over the body. Now, children do have thyroid disease right from birth up to adolescence. They can get, and the symptoms or the presentation is different according to the different age group. Now the problems can be that the gland isn't formed itself, so that is when the child will present at birth with congenital hypothyroidism. And the other problems are autoimmune. They present later on.
All right. Because of time, I wish you could have continued this conversation, because it's so very enlightening, very educating also. I've learned so much, because I didn't know that some few things actually affect our children. Thank you so much, Dr. Madhuro Joshi, for coming. I appreciate. And apparently we had your husband here the other time. Dr. Joshi, interesting. You all chose the midi corner. Interesting. Congratulations. Thank you so much.
Thank you.
All
Thanks
right.
a lot.
But take a short break. Could you come back right in Morning Live? We want to talk about a special app about the motorist. It's actually out here to help motorists. Well, by now, if you are an amateur, you own a car for the first time and don't know what to do about your car when something happens, there's an app that can guide you. Or they're coming to you after a short break. Stay tuned to Morning Live.